Buenas noches. Ante Karima, and I'm a midwifery student, and I completed my 6th day of integration today. I was in clinic. My preceptor and I saw 12 patients. Today, what kept coming up was Group B Streptococcus, GBS. So I'm going to go over what it is, a brief history, how the baby can be exposed to GBS, the antibiotics, and then a holistic approach. So GBS, it's a normal bacteria living in the intestinal tract of healthy people, and it's found in the throat, in the urinary tract, and the respiratory system. And about 6 to 40% of pregnant people have asymptomatic GBS in the birth canal. About 1/3 of women worldwide have GBS, and about 1 in 2,000 newborns are exposed to GBS infection. Briefly, the first biologist who found GBS was back in 1887. And in 1935, they found GBS in the vagina. Then in the 1970s, GBS became the leading infectious cause of early neonatal morbidity and mortality. So a lot of babies were dying. And then in 1996, the CDC and other agencies came up with some guidelines to help prevent Group B Streptococcus disease. And then in 2010, the CDC came up with the guidelines of screening pregnant people between 35 and 37 weeks gestation for GBS. So GBS, in pregnancy, it increases the chance of chorioamnionitis and then postpartum endometritis. And the baby can be exposed to GBS in 2 ways. The first is by pre-existing intrauterine infection. So from the time the baby's born, within the first hour to the first 1 or 2 days, the baby can, they call that early onset GBS. The baby can get sepsis, pneumonia, meningitis. It's really bad. And then the second way is through exposure by the environment. So within the first week to several months after the baby's born, they call that the late onset of GBS. And the most common is meningitis. And then the ways to test for GBS, this is done in the hospital and in the home births I've seen. So the midwife gives you a swab, and you go swab your lower vagina and rectum, and it's really important to swab both your lower vagina and rectum. And then the culture is sent off, and the results are valid for about 4 or 5 weeks, and you would be retested if you were post-dates. So that's how it's done. And so in labor, you would get the antibiotics if you tested positive for GBS in the current pregnancy. Or it doesn't matter if you had GBS in a previous pregnancy, but if you have had a baby who got sick because of GBS in a previous pregnancy, then you would get antibiotics as well. And other indications are if the onset of labor is less than 37 weeks and the GBS status is unknown, or if you have a fever greater than 100.4, or rupture membranes for more than 18 hours, or the NAAT tested positive for GBS. Those are all reasons why you would get the antibiotics. And the antibiotics are penicillin, and ampicillin is an alternative. But if the pregnant person is allergic to penicillin, then we do a sensitivity test to see if you would be given clindamycin, erythromycin, or vancomycin instead. So those are the antibiotics. And in terms of the holistic approach, if you really don't want antibiotics, then it's really, really important all throughout your pregnancy to take care to boost your immune system, to eat probiotics, so yogurts, raw foods, the green, yellow vegetables, to supplement with probiotics, and to eat a clean diet without a lot of sugar. That's all really important and can help. And if you do test positive for GBS, you can also insert garlic cloves vaginally every day for up to 10 days and then get retested. Or, you know, the vaginal vinegar flushings, or insert the probiotics vaginally. That all helps as well. And then during labor, it's important to not have artificial rupture membranes or the stripping of your membranes, to limit the amount of dilatation checks, and to monitor the signs and symptoms of infection. And lastly, just be prepared to receive antibiotics if necessary. So that's a little bit on GBS, and I hope you found the video